Are you a parent who's worked rigorously with oral motor massages and still don't see enough of progress in your child? Or are you a speech and language therapist like me, working with a lot of children at the same time, one after the other, probably with the diagnosis of cerebral palsy or Down syndrome, or the child you're working with has low muscle tone, there's pooling of saliva. You're doing all that you can with oral motor massages, yet you haven't seen measurable progress. If this is you, then what we're going to talk today about oral motor massages will definitely be of much help. The question is, do oral motor massages help in drooling management? This is what we're going to talk about today. And if you haven't yet liked or followed or subscribed this page, go ahead and do it now. If you are on YouTube, click the notification button to be notified every time we post an informative video like this. What is saliva or what is drooling? Drooling is the inability to hold the saliva within the lower lip or an inability to swallow the saliva. What happens when children don't adequately swallow the saliva or they're not able to manage the saliva with their oral structures is it becomes difficult for them to masticate, chew, swallow. It also becomes difficult for them to motor plan for complex speech sounds. Apart from this, when children are unable to manage the secretion of saliva by swallowing it inside, and if the drooling persists, then you can expect to see a lot of rashes around their oral structures. You may see secondary bacterial infections, social stigmatization experienced by the child and the family. You also can see a difficulty in terms of aspirations. There could be silent or there could be evident aspirations because a child is inhaling his or her own saliva or inhaling the fluids or the food that the child is consuming. So these are some of the many challenges experienced by children who have drooling. Now, talking about management for drooling, which is very important, there are two types of management. One is the non-invasive and the other one is the invasive. Non-invasive management is the oral motor therapy that we provide or medications. And when these two don't really help, then parents can consider a surgical intervention or radiotherapy as an option. But the fact is, I read a few journal articles, research papers on this, and this is what these research papers have to say, that the medications that is offered for drooling management sometimes lead to excessive dryness of the oral structures, affecting the dental health and creating dryness of the tissues of the mouth, which has secondary challenges. And many a times children tend to be over drugged, not that the physician wants to do it, but because it's very hard to measure how much of drug to be, um, started on with. When these two methods don't really help, then the physician probably can opt for a surgery. Again, research papers indicate that one third to two-thirds of people who undergo these surgeries find a lot of side effects of these surgeries, which affects their oral motor tissues, and dental problems are often experienced. So, with this said, as a speech and language therapist, I'm going to give you my suggestions in terms of drooling management. However, in chronic drooling, especially when it comes to children with a diagnosis of cerebral palsy, it can be really hard, but we can manage drooling to a large extent by the strategies we're going to talk. Now, if you ask me a question, do oral motor massages help in drooling management? And if I were to give you a single word answer, the answer is no. But in this video, I'm going to explain to you the benefits of oral motor massages. At the same time, what else can be done along with oral motor massages to make management successful and effective for children who are experiencing drooling. Now, imagine this is the child that you're working with. the child has severe drooling and you're working on the child's oral motor massages. However, you have not positioned the child right. Maybe the child is drooping forward and his hands are out like this, they're not in midline, then you can definitely expect the child to continue drool no matter how hard you work on the oral motor massages. So the number one priority in management is get a child to sit upright with the right posture, with sufficient support, ensure that the child is comfortable in this kind of a sitting posture. When you work on a posture such as this, you will be able to help the child with drooling because you have given adequate support for the trunk as well as there's adequate support for the neck. So this is the posture you will help the child to be seated in. But what about a child who has a really poor oral motor control or really poor muscle tone because of an underlying recurrent seizure attack or a severe condition in terms of cerebral palsy? In that case, I recommend that you put the child in sideline posture, probably with adequate support, like this. So the child is elevated comfortably and you can prevent drooling to a large extent. The reason I am recommending sideline posture is many children that I have worked with, when they are laid upright, they tend to have noisy breathing or stridor, which can also cause more aspirations. So a sideline posture is one of the safest. But if the child you're working with is comfortable upright this way in a elevated posture, then go ahead with it as well. So that is the first consideration in drooling management in terms of non-invasive methods. As a speech and language therapist, what you can do. Once you settle the posture, then we work on the oral sensory awareness. Now, this is where your massages come into picture. So using your fingertips to provide oral motor massages around the mouth, around the cheeks, all the muscles that are innervating towards the lips. These are some strategies that can really help. Your oral motor massages can really give the child adequate sensory awareness. You can do it outside as well as inside the mouth. Along with it, do combine using icing as a method of intervention, because when you do icing, the effect can be seen for the next 5 to 25 minutes. It can improve swallowing in children, thereby reducing drooling. It can also help the child feed better. Use also various brushes to provide vibration or strokes inside the oral structures to facilitate better oral awareness, thereby facilitating the child to swallow. You can also sit in front of the child and show the child how to swallow through demonstration or modeling, and the child can be encouraged to follow after you. All of this you can consider for oral sensory awareness. That is consideration number 2. The last and final consideration, which is also critical, is the oral motor strength. Start with the jaw because your lips and your tongue are placed over the jaw. So you start with the jaw, move to the lips, and then to the tongue in terms of strengthening. In several children, working simultaneously on all these structures can also prove to be beneficial because the tongue strengthening exercises, especially with pressure that you give, can help jaw, lip, and tongue control because they're all interconnected and interrelated. However, if the jaw is going to be in the open posture, no matter how hard you work on the lip seal or the tongue tip, lateralization, elevation, depression, range of tongue movement, we're not going to see adequate progress. Work together or start with the jaw depending on each child's condition, because our methods should vary and must vary with the child's needs, right? So that is the last consideration, which is oral motor strength. When you have considered postural stability, oral motor awareness or oral sensory awareness, and oral motor strength, with all these three done in combination, can definitely reduce drooling to a very large extent. I hope today's video has helped you understand drooling management more in depth. And if oral motor massages can help drooling management, the answer is no, if it is done in isolation, and yes, if it is done in combination with posture, oral sensory awareness, and oral motor strength. Like, follow, and subscribe for more such informative videos. Thank you.